Good afternoon, everybody.
So you've heard a lot about Scotland today. Thank you to Iveta. She's very enthusiastic, shall I say, and very supportive of the journey that we've been taking in Scotland. So what I'd like to do in the next 15 minutes is give you a very brief overview of what we've been doing to integrate health and social care in Scotland, but also to touch on how we've been trying to utilise the new and emerging technologies that are available to try and support that integration agenda. So Scotland, and we always try and get a bit of tartan in wherever we can, because we're very proud of our tartan. Scotland, as you know, is a very small country. It's part of the UK, and we are still part of the EU, but that is a very different discussion, perhaps for dinner later on, maybe. We have a devolved parliament in Scotland, and we're, again, political, but we'll go into that later. But that means that we have also devolved responsibility for the delivery of health and care. So although we have an NHS, a National Health Service, based health care provision, so that's free at the point of access to our public, our citizens, it means that the Scottish Government are able to shape and deliver those services in the way that we see fit. So it looks very different to, health and care looks very different in Scotland as it does in Northern Ireland, Wales and England. We have 14 health boards that provide and are responsible for healthcare delivery, and we have 32 local authorities that are responsible for social care delivery. But as part of our integration agenda, we have actually merged the responsibilities for health and social care, and we now have 31 integration authorities that are jointly responsible for the provision of health and social care in Scotland. So the challenge, and I'm not going to dwell on this very much, because the challenges you'll see on these, or the challenges that we face in Scotland, are exactly the same as all of the challenges that you are facing in your regions. So there's no point very much on dwelling on these. But I think for us, the main point that we have tried to address in Scotland is this issue of not only the sustainability of our health and care services to address and meet the challenges of our rapidly growing ageing population. It's also about this issue of quality. How can we really make sure that we're delivering quality services to that growing population? So we engaged and have been on a journey of reform of health and social care for really over 20 years. And I think the first lesson that we can share, and I'm sure you'll recognise this, is there is no quick fix. There is no quick fix solution to integration. It's a long-term commitment and it's a long-term journey towards that end and goal. So for us, we wanted to make sure that adult health and social care services were very much person-centred. So what is it that the person, the citizen themselves requires, and how do we also support their carers and families around them, because that's a critical support network that we often overlook, and we really do need to make sure we look after them. That also the providers of health and care are jointly accountable for delivery and improvement and quality services, so that we can't blame our health colleagues for not doing their part or our social care colleagues for not doing their part. We're actually jointly responsible for the delivery of health and care. And that's a significant change in the way that we were thinking prior to integration. And really importantly, that there are financial mechanisms that allow you to share, again, the way that you shape your budget and the finances that you have available for health and care. Because if organisations and entities keep their budget and are responsible for their own budget, it's very difficult then to get other entities to pay for services that aren't necessarily yours. So we needed to put in a financial framework that allowed us to have joint accountability and delivery of those services. So I'm not going to go into any detail on this slide, but this is us trying to capture the history of the last 20 years into one particular slide so you can see it. So you'll see on the left-hand side, we started this journey way back in 1999, so 20 years ago. Was I involved in it? Yes, I was. Sadly, I was involved in it way back then, so I've been here for 20 years in Scotland. Not just me, clearly, but there are a few of us around still working on this. But what I wanted to highlight was the fact that we have tried to introduce legislation that will assist with the integration journey 3 times during those 20 years. So we did it first in 2002 with the Community Care and Health Scotland Act, and that's where we thought it would work. Everybody would come together, so health and social care would integrate, it'd be fine. No, it didn't work. And I won't go into those reasons why it didn't work, because we don't have time. But we tried again in 2004, where we brought in the NHS Reform Scotland Act, which again required our health boards to establish community health partnerships that would try and bring those services together. That didn't quite work either. Elements of it did, but it didn't quite fit the bill. So in 2014, 10 years later, we introduced the Public Bodies Joint Working Scotland Act. So this is our latest attempt to try and get the legislation and the governance at a Scottish, or a national level, a government level, in place to enable you to have that framework, that legal framework that allows you to integrate. That was obviously 5 years ago. We're still implementing it. We're still facing some of the challenges around that. So it may well be that if I'm around in 10 years' time, we'll have introduced another set of legislation, who knows. But we're trying. And I think along the bottom here, what you see are some of the national strategies that have gone in to try and support the implementation of that legislation. So they're strategies that are trying to help our health and care authorities shape the way they deliver services on the ground. So that's our integration journey. So we have the legislation, we have the political commitment to health and care integration, which you really do need. You need that at a national level, a regional level, in order to be able to implement it. And another critical point is you need a long-term commitment at a political level. You can't just change after 5 years the direction of travel. That will undermine everything that you've been doing. So it's very important to have a consistent long-term leadership from a national government level. But you also then need to put in place measures that will try and help the people who are at the front line trying to deliver health and social care services to integrate. And there are a number of different ways that you can try and tackle that. For us in Scotland, we really did recognise very early on that technology and innovative service models really play a huge part in trying to pull this agenda together. And that's about really connecting and empowering people and individuals to work together. So for us, we introduced our first digital health and care strategy. This really outlined how we wanted, from a citizen perspective, health and care services to look. So for us, and again, I'm not going to go into detail because we don't have time today, but we have 6 areas of focus in that digital health and care strategy. And you can see that they're fairly obvious. So again, national direction and leadership to make sure that our health and care partnerships have a very clear direction of travel at a national level. The information governance and assurance and all the technical aspects around the infrastructure that you require. Service transformation, which is the one I'm going to focus on today, which is about redesigning the way that you deliver your care pathways, your health and care pathways, to ensure that technology can actually support those care pathways. Workforce capability, which is an incredibly important aspect of this. Do our health and care staff have the technical capabilities and knowledge and skills to actually utilise and adopt digital solutions in their everyday work? Digital platform and this transition process, which is around the change management, the changing hearts and minds, which is incredibly important. So for us, the service transformation agenda we have set up a national technology-enabled care programme, and that's been supported by the Scottish Government for a very long time now. So again, a long-term national commitment to supporting the use of technology in health and care delivery. Just briefly, this is how we describe technology-enabled care. So it's really using technology to help support individuals and improve their outcomes while they live at home for as long as possible. So the programme, this latest draft of the programme was launched way back in 2014, but it's been running in Scotland for almost 15 years now. And we really made the main focus of this programme is to actually take tried and tested technologies and mainstream them. So stop this project mentality where you try it with a few citizens or patients and then the project stops when the funding stops. This is about us taking national solutions and rolling them out across the piece. So our national tech programme has a number of aims and objectives, and it's really about embedding it within service planning and design, and ultimately improving the health and well-being outcomes for Scottish citizens. So how have we done then? How have we been progressing, and what have we managed to achieve? Well, since the programme was introduced back in 2016, and this number is 2014, sorry, this programme's number is actually out of date slightly. It's almost 100,000 citizens that have directly benefited from this project, although the numbers will come on to perhaps later. And that's been through a number of different programmes. So I'm going to touch on just a couple of them because we don't have much time today. But we developed a home and mobile health monitoring national framework, which means that this is about the technologies that people and citizens can use to monitor their own health and well-being. So these are things like wearables. These are things where you can measure your blood pressure. You can measure various physiological not symptoms, but anyway, your physical state, and that you can use those things and relay that data back to your clinician so that it can improve the way that you manage your condition and also the way that they deliver support to you. So rather than doing a large number of projects, we introduced a national home and mobile framework, and that's been really useful for us to give the strategy behind what we're doing. So this is about using mobile technologies to promote and aid diagnosis, assessment of treatment, symptom control in the main. And this is just one of the technologies that we've introduced at a national level. So we now have over almost 19,000 citizens that are using this particular simple telehealth messaging solution to monitor their blood pressure. And that's really been rolled out pretty much across all of our GP surgeries. So we now have almost all of our territorial health boards using this, which is really good. And in terms of the citizen feedback that we've had, the citizens are coming back and saying this is actually really giving us control over our own conditions and helping them learn more about what their condition, the variations, and how they can manage it themselves. And our general practitioners really like it because it's a simple, easy to implement solution that benefits them as well. Video consultation is the other large programme that we've been running out. Now, we've been trying to do this for a number of years in Scotland, but through the developments in new technologies that are low cost and browser-based, so we use Chrome to access these, we're actually rolling out a particular product called Attend Anywhere, which we not quite stole, but bought from Australia. And this is now allowing our general practitioners, our care homes, our residential care homes, and indeed some of our hospital clinics, increasing number all the time, to actually connect them with their physician. So either the citizen from their own home with their general practitioner or consultant, or indeed the consultant to the general practitioner. So it's reducing travel, it's saving time, and it's much more convenient for our citizens and our consultants. And then the final one that I'm going to touch on is digital telecare. And this is welfare technology, I think that you might all recognise. So these are technologies that can stay in the person's own home and support them to actually stay well and identify any risks that are within the home. So risks of falls, risks of fire, those sorts of things. And we're moving from our old analogue service to our digital Telecare service, which is really opening the doors to supporting people for much longer and in a much more sophisticated way. And very briefly, with my last maybe 30 seconds, I'm going to very quickly touch on just some of the other aspects of this. And I suppose these just touch on some of the messages that we've learned about using and rolling out at scale technology in support of integration. Integration is not just about health and social care. It's about everybody who's involved in that agenda, including and primarily the citizen themselves. But for us, some of the other key partners and stakeholders that you have to involve in this integration agenda are your housing providers, your fire service, your police, indeed, your police service, your ambulance service, all of those different services that wrap around an individual, particularly as they age, because it's incredibly important that you all work together on this agenda. And this is one of the products that we've just produced with our housing colleagues around different technologies that can support somebody in their own home. The other message that I wanted to bring across is this is not just about ageing and older people, though we've spoken about that a lot. This is also about young people, and from cradle to grave we can use technology to support people, and this is just some of the things that we've been doing around younger people. And dementia, people living, one of the other messages is really around the use of technology. There's always been this, a bit of a myth actually, around the fact that older people can't use or don't want to use technology, and that's absolutely not true. We've found real successes from the use of technology in supporting people living with dementia and their families. So we should never write off people because of their age or indeed their condition. And the final point that I wanted to make was, and I've touched on it briefly, is this issue of having to support our workforce and actually enable them to have the skills and expertise to utilise digital technologies in their everyday working lives. We all use them in our personal lives, but actually we really need to invest time and effort in equipping them with the skills to use them in their working lives. And that's me. Thank you.